Hello again, I'm Dr. Ryan Bell with Yada Yada Health. Fevers are a hot topic in the world of pediatrics. Let's talk about some of the basics. Fevers can be really concerning to parents. They can signal serious disease and infections and things that can be very worrisome. So it's important to have a basic understanding of fevers and some of the things that we look for to either be reassuring to us as providers or to be worrisome. Generally, a temperature is considered to be a fever if it reaches 100.4 or higher. Anything under that tends to be just a child who's warm. That can happen for various reasons. Teething would be a common reason for that. A lot of kids, when they're teething, will reach temperatures of 98, 99, 100. But you really shouldn't get into that fever range if it's just teething. So if your child has a temperature of 101, it's probably not just teething. There's probably some infection going on as well. Most infections that cause fevers are going to be viruses. Important things to think about when it comes to infections and fevers is any other factors going on at the same time your child has a fever. The most important ones for me would be, how is your child doing with his breathing? Is your child staying hydrated? Does your child seem to be in a lot of pain? Those are important questions. If you have concerns in any of those areas, it probably warrants getting in to see your provider, doing a good exam, figuring out what's going on, especially if there's breathing issues. So that's one to really watch. Other factors when we look at fevers, has your child had immunizations recently? So very commonly, especially our 1-year-old set of shots and our pre-kindergarten set of shots can lead to fevers. Those fevers can spike sometime over the next week from when your child got immunizations. You don't expect to see a lot of other symptoms with those fevers. Sometimes a rash, but you shouldn't have cough or be in a lot of pain anywhere. Pussy drainage at the site of an immunization. Those would be things that we would worry more about. So keep those in mind. Other basics as far as fevers are concerned, we like to have parents check a temperature at home. There are different types of thermometers that you can use. I've always bought just a basic, pretty inexpensive thermometer that I can put under my child's tongue at home, get a number. Those can also be used to check rectal temperatures, which are considered more accurate, but obviously more inconvenient and not tolerated as well. In a young child, sometimes a rectal temperature is important to really give you a good accurate number. There's some debate about reporting temperatures. We tend to not worry about them so much as people report temperatures as far as where you took it. The old rule of thumb was to add a degree if you're checking a temperature anywhere other than rectally, but I always like to just hear what the temperature was and how you took it. Generally speaking, a temperature of 103 or higher warrants a lot more attention than a lower grade fever, which for me would be 101, 102. If your child has a temperature of 103 plus, or they're having fevers for more than 3 days, the general rule of thumb is to have somebody take a look at them and help you figure out what's going on, why your child has a fever, and if there's anything else to be worried about. There's always been a debate about fever responses and if there is any benefit physiologically to the body having a temperature, if it helps to fight off infections. There might be some truth to that idea. If your baby is uncomfortable with their fever, they're usually not going to sleep very well. They're not going to eat or drink as well. So the benefits of doing ibuprofen or Tylenol generally outweigh any benefit of letting that fever run its course. So if your child is comfortable, great. We love to not give them medicines if possible. If your child seems uncomfortable and is struggling to sleep or to drink, go ahead and do some medicines. Your two best options are going to be acetaminophen or ibuprofen. Children 6 months and up can do ibuprofen in addition to Tylenol. Children's that are 6 months and younger, we like to stick just to Tylenol. Tylenol can be dosed every 4 hours, ibuprofen every 6 hours. Be sure you get a good, accurate dose based on your child's weight if you're going to be using those medications. Another common issue we see with fevers in the clinic would be that fevers can cause seizures. Febrile seizures occur in about 1% of the general population. It can be either as the fever's developing rapidly or as the fever disappears rapidly. It can trigger a seizure. These are scary moments for us as parents, but generally not considered dangerous events. If a seizure occurs, if you have concerns about your child's breathing, if a seizure is going on for more than 3 to 5 minutes, those would be reasons, obviously, to call 911 and have your baby looked at and rule out other possibilities that can cause seizures. But a diagnosis of a febrile seizure is one that we see fairly often that really is a pretty benign diagnosis in children. I often get asked the question, how high does a fever have to be for it to be dangerous? A fever itself would probably have to be in the 105 to 106 range for it to be dangerous to your child and his or her body. That being said, a lower fever, 101, 102, depending on associated symptoms, can also be very dangerous. So it's not just looking at the number, but really looking at the overall picture of what's going on with your child. Another issue that we see with babies on this topic of temperatures and fevers is that quite often babies don't mount the same immune response as an older child or an adult. A baby can be very sick, and instead of developing a fever, they can actually get to where they're hypothermic, where they're too cold. And so if your baby feels too cold, that can be as worrisome to us as if your baby's got a fever. So anything below 96.5 is considered too low of a temperature. Definitely have your child seen and looked at and figure out what's going on. Other factors that make us worry more about fevers, if your child is immune compromised for some reason, if they're being treated for cancers, if they're on steroids, those types of issues make a fever more worrisome. You'd have a higher index of suspicion that something serious is going on and to get your child in to see their provider. We worry in babies less than a month old. Any fever, temperature above 100.4, or being too cold below 96.5 within that first month of life warrants a prompt evaluation, often even a readmission to the hospital for a workup. Past medical history also is a factor. If your child has had urinary tract infections in the past and they develop a fever, we're going to be more worried about that child. We're going to be quicker to check a urine. Any history of pneumonias, recurrent ear infections, anything along those lines, we're going to have a higher index of suspicion of repeated infections. Other symptoms that are going to be problematic and warrant a prompt evaluation: a severe headache, a stiff neck, again, difficulty breathing, altered mental status. Those would all be reasons to get your child in promptly for an evaluation. In general, fevers are very common. Most of the causes for fevers are fairly benign. Again, most things are viral and we're not able to do anything specifically to treat them. But you do want to make sure that you're not missing an underlying serious infection. Be sure your baby's staying hydrated, breathing well, not in a lot of pain, and generally with those kids, if they're otherwise healthy, we're able to do ibuprofen, do Tylenol, give them a lukewarm bath, or to place some cool washcloths on places like their forehead, their neck, their armpits, their groin. Those things will all help to gently bring down that temperature and allow your child to be more comfortable. Those are the basics for fever. Thanks.